My name is Jessica Kennedy Schlicker. I'm a physician in family medicine. I'm board certified in family medicine, and I work at Harrison Urgent Care in Port Orchard and Belfair, Washington. Today we're going to talk about the difference between emergency care and urgent care, and how you can choose where you might obtain the most appropriate care for your condition. Problems that are urgent are issues that need to be seen today. Things that require attention in a rapid fashion, but not a life-threatening emergency. A good example of that would be a fracture or a cut in the skin that needs stitches. Most causes of back pain can be managed in the urgent care. Most injuries, things like heartburn, pneumonia, bronchitis, influenza, stomach bugs, things like that can be managed very well in urgent care, and generally will get you back to your life faster than a trip to the emergency room. The most common problem we see in urgent care that needs to go immediately to the emergency room is chest pain. Especially if you're over the age of 40, chest pain is can be a very serious symptom of a life-threatening heart or lung problem, and those issues need to be seen immediately in the emergency department. What we do here in urgent care when we see that is we have a very standardized protocol where we place an IV, we give the person oxygen and medications, but we get them by ambulance over to the emergency room immediately because Harrison has the definitive cardiovascular care that you might need in that situation. There are great guidelines that have been published by the American Academy of Family Physicians and the American Academy of Pediatrics, which tell us very clearly which types of symptoms in children tend to be more of an emergency. For example, a fever in a child less than 90 days old should probably be seen in the emergency department because the immune system is not mature enough yet to have fought off some of the more common illnesses, and children can become very ill quickly. Most childhood illnesses we treat in the urgent care. It's much less common for us to send a patient to the emergency room from the urgent care in a pediatric situation, but certainly if a child were to have been involved in any trauma, a fall from a height greater than 5 feet or greater than the child's own height, so a major trauma, a car accident, a fever in a child less than 90 days of age. If you do come into urgent care and need to go to the emergency room, we would explain fully why that would be, and then we would recommend whether it would be safe for you to go by private car or in an ambulance. Certainly I recommend that no one with chest pain ever drive himself to the hospital, and it's much safer to go in an ambulance. In urgent care, we try very hard to get you in and out as quickly as possible. We have most times a very short wait, and those wait times are always available on the Harrison Medical Center website, as well as the ability then to make the comparison between the emergency room and the urgent care in that situation. If you were to have something, for example, like shortness of breath that were to start all of a sudden, or symptoms of a stroke, weakness, numbness, tingling, difficulty speaking or swallowing, something that starts all of a sudden, those could be signs of a stroke. And in the case of a heart problem, a serious breathing problem, or a stroke, you want to be seen immediately in the emergency department in Bremerton. Many people who go to the emergency room with minor conditions could probably be treated in urgent care. For example, people who go with back pain, headaches, if it's something that you deal with on an ongoing basis. Medication refills when your doctor's out of town. If you're in a pickle and can't get what you need, the urgent care is the place to be because you'll wait less and probably get out sooner and back to your life more rapidly. If you're involved in a car accident, even if you walk away from it, the most important thing you can do is go to the emergency room. Very often you do need CT scanning of the head or neck to make sure you don't have a serious injury. In addition, a fall in which you sustain a head or neck injury is something that really should go to the emergency room. I'm Dr. Jessica Kennedy Schlicker, board certified in family medicine, and I work at the urgent care in Port Orchard and Belfair. If you have any concerns at any time, please do give us a call, 360-744-6275. Thank you for listening to DocTalk, and choose well.